Hi there. We are going to talk a bit about ablative technologies that are available today for cancer treatments in various solid organs, such as the kidneys, the liver, the lung, and the bone. There are various ways to treat these tumors, especially metastatic tumors as well as primary cancers in these organs.
How do you treat these tumors?
Two common ways to treat them are RF ablation, also known as radiofrequency ablation, and cryo ablation. There are other modalities that are relatively newer, such as microwave ablation, HIFU, and IRE, but the two mainstay therapies that we have abundant literature on are RF ablation and cryo ablation.
What is radiofrequency ablation?
RF ablation uses heat energy, or RF energy, that is converted to heat energy and destroys the tumor by essentially burning it out. High temperatures are reached within the tumor, but the surrounding tissue, the normal organ, is protected from this. The way RF ablation is done is through what's known as a percutaneous approach. A needle, which is a small little needle, is placed directly into the tumor, and then it's connected to the RF energy generator. Heat is applied to the tumor via this needle. RF ablation is usually done under general anesthesia, although occasionally we will do under what's known as conscious sedation or moderate sedation. The reason why we do it under general anesthesia is to prevent any pain that can occur when we are burning the tumor out.
What is cryoablation?
Cryoablation, on the other hand, uses ice or sub-zero temperatures to kill the tumor. The way cryoablation is done is again percutaneously, that is, a small needle is placed into the tumor and then connected to a generator which will take the temperature down of the tumor to a sub-zero level. Cryoablation, as opposed to RF ablation, is done under conscious sedation, which is light sedation. You're sort of in and out of it, and you really don't feel anything while you're doing the procedure.
How effective are these procedures?
Both these procedures are extremely efficient in killing tumors. The differences lie in which organ you're trying to ablate. For example, if a liver tumor needs to be ablated, the preference usually is for RF ablation. This is based out of the fact that we have some more literature in the liver for RF ablation. On the other hand, if we are burning a tumor in the kidney, we would use cryoablation.
Can these treatments be used to target cancer in other areas of the body?
Similar to both liver and kidney tumors, metastatic disease to the bone can also be treated with ablative technologies. Typically, this is used as a palliative procedure, as in we are not curing the cancer, but we are trying to get rid of the pain that is associated with bone metastasis. Another application of any of these ablative technologies is in lung. It has been used both in primary lung cancer as well as metastatic disease from another tumor elsewhere in the body.
What should I expect after the procedure is completed?
Postoperative care for ablative technologies is extremely simple. You're usually discharged the same day or the next morning if the case is done late in the evening. In terms of postoperative management, really there are no limitations. You can go about your work, your job immediately as long as you're feeling up to it. Two things that we do worry about or are known complications of ablative technology are bleeding and infection. Bleeding is extremely uncommon and noted immediately during the procedure. Infection, on the other hand, can set in 1 to 2 weeks after the procedure. These procedures are all done under sterile techniques, and it is very, very uncommon to see an infection in this setting. However, if you were to get chills, fevers, rigors a week or so after an ablative technology, it would be of concern, and you should reach your interventional radiologist immediately.